Howdy, I'm Jonathan Baker, and this is my Lightning Talk. For Module 4, I learned how different parts of the Social Ecological Model affects infant mortality rate. I found that in that social ecological model, it was made up of several different attributes: interpersonal, interpersonal, organizational, community, and public policy factors all contribute to the likelihood of a child living or dying before its first birthday. So this made me ask the question, out of all the factors listed, which one plays the biggest role in keeping a child alive for its first 365 days after its birth? I asked this question because I have a story my mom and my sister told me after their trip to Haiti this past year. Their guide in Haiti, who had been leading groups all summer, was a 24-year-old girl who had to witness two very sick twin baby girls die in the span of 2 days because of the lack of medical treatment. I was wondering if they had access to medical care, that it would get them through their first year, or if that's just one of the many factors of the environment they were in. I speculate that community factors play the biggest role in keeping infants alive. This category includes the neighborhood, healthcare provider, infrastructure, public education, community services that a child is born into. I found a clear distinction between developed countries and developing countries in looking into this. A 2016 study from the CDC showed the leading causes of infant death in the United States, a developed nation, number 1 being birth defects, number 2 being preterm birth, number 3 being sudden infant death syndrome, number 4 being maternal pregnancy complications, number 5 being injuries, like suffocation. Meanwhile, in the 2010 Countdown Decade Report, shows the 6 conditions that account for about 70% of all child deaths in developing countries. Acute lower respiratory infections, mostly pneumonia, account for 19%, diarrhea for 18%, malaria for 8%, measles for 4%, HIV/AIDS for 3%, and neonatal conditions like preterm birth problems and infections account for 37%. As you can see, there's 2 different problems in these 2 different statistics. One is a much higher infant mortality rate per capita, and 70% of the deaths were caused by disease and illnesses. These stats prove that the community and healthcare aspects are close and possibly the most important aspect when determining leading factor in infant mortality rate. Thanks, and gig 'em.